seated active assistive knee flexion. So we're using an exercise ball here to help give us an advantage or a better position to work on a knee flexion. So we use this a lot post-surgical, someone that has a stiff knee, just trying to improve our ability to bend our knee. And I'm going to use the plyo box here as a wall. So this is best done if you take an exercise ball and put it in front of a wall, or even better yet, kind of go to a corner so you can put your hands up on the corner so you're more stable. So that way you don't feel like you have to balance on the ball, especially those of you that are coming off of like a surgery, so you don't want to lose balance and trying to put a bunch of weight to that surgical limb. But what we're going to do is we're going to use our non-surgical limb. So in our example, let's pretend my left leg is my surgical limb. I'm going to use my right leg to kind of put pressure and to guide the range of motion into my left leg. So if my hand is on the wall here, or the box in this example, I have my right foot out in front of me. I'm just focused on right now left knee flexion, or bending my knee. So I'm going to roll forward, and I'm going to go to where I feel a stretch. Now this is going to be different for everybody depending on what sort of injury you're rehabbing or what you're working through. That should be kind of depicted into your programming notes, if how much pain you should push into, if you should have pain, if you should not have pain, how long you should hold that stretch position, which would be the knee bent position. Typically what we're going to do, we're going to come down, hold for about 10 seconds, and then we're going to rock back out of it. And then this is just kind of like the active assistive range of motion. And then the other option is I can put a little bit more weight into this left leg by bringing my right foot back so my feet are almost more symmetrical. And now my quads are eccentrically controlling the knee flexion, and then I got to drive back out of that. So it's just a way for me to be able to put low load through the quads, be able to work on knee range of motion in a more controlled fashion. Usually this is more comfortable than like sitting on your back and like hooking a strap to your foot, kind of forcing that knee flexion motion, when you can just sit on a ball and have the same effect. And the other thing that we can do that I like in this position is we can kind of use the friction of the floor and our foot to be able to hit the muscles on both sides of the knee joint, being our quad group and our hamstring group. So what I mean by that is if I lean into that, say I start to feel a slight stretch, then I can push my foot into the floor, like I'm going to straighten it, and get enough kind of friction to where it holds for 10 seconds, and then pull my foot back, like I'm pulling my foot back to get my hamstrings to fire, and hold that for 10 seconds. A lot of times putting the joint in a spot where you feel like a stretch position, and then contracting the muscles on both sides of the joint will help alleviate some of the irritability. So this would be another example. Again, I gave you multiple examples in the video. Make sure you take a glance at the programming notes to get an idea of what your sets and reps are and which type you're going to be doing.